Hello, PsychU community. This is Dr. Fatima Sadat, Medical Science Liaison for Otsuka Pharmaceutical Development and Commercialization Incorporated. And I'm joined here today with Dr. Mona Sobhani. Dr. Sobhani is Director of Research and Operations at USC Center for Body and Computing. Her research studies have included investigating the relationship between health outcomes and technology, including wearable devices and mobile apps. Dr. Sobhani holds a Ph.D. in neuroscience from USC and a postdoc from Vanderbilt University. Today, we are here to discuss privacy and security as it relates to the COVID-19 pandemic. So let's dive right in. Dr. Sobhani?
Thanks, Fatima. It's great to be with you today. It's a really interesting time for privacy and security during this COVID-19 public health crisis. We're seeing in response and rapid response to the outbreak of the pandemic, we've seen kind of a knocking down of regulations that we've never seen before, in particular around healthcare, including mental health care. So a few examples are one of the barriers in widespread adoption of digital health in particular has always been, especially for telehealth, that it was difficult for physicians to practice across state lines because of the licensing barriers. So during this pandemic, we've seen that essentially be lifted for Medicare at least. I think they initially were leaving it up to the states, but my understanding it's been widely adopted. So to kind of free up the distribution of available mental health as well as just general health care to the broader population and just kind of remove that barrier, they've knocked that down, which is pretty unheard of and amazing. And it's because of the social distancing requirement, right, to really limit the spread of the virus. They want to discourage in-person visits and keep people in their homes as much as possible, but it doesn't stop the need for people, right, requiring healthcare, including mental health care. So they've had to find ways to improve accessibility of healthcare, and telehealth was one way to do that. Removing licensing requirements was one way. Another thing that the Office of Civil Rights said that they wouldn't enforce during this pandemic is that before this, there was a requirement that any video conferencing needed to be HIPAA compliant for really any healthcare, including mental health care. And so that limited the platforms and services that physicians and their patients could use. But they've lifted that requirement during this pandemic. And so you'll hear stories of therapists and psychiatrists and other doctors in general FaceTiming their patients or using any kind of video conferencing platform that isn't HIPAA compliant just to be able to speak with their patients and give them the healthcare that they need. So that's a pretty huge thing that's never been available before. And it does raise some security concerns, but the other interesting thing that it does is it will allow us in the future to see kind of in a trial and error thing out of necessity, if there are breaches of like widespread breaches of patient health information, if the sessions are being hacked, it's kind of like just a case study. So I guess we'll see what happens. So there is that security concern, but it's one of these weird situations that is arriving with the pandemic in that it's just a necessary thing that needed to be done to help people get access to care. And if that means using a non-HIPAA compliant platform, then that's what it shall be. So those are some of, I think another interesting thing is there's been a lot of the regulations knocked down. And another thing is that with regards to, I think with mental, I don't know if it's specific to mental health, it might just be healthcare in general. They also didn't allow for reimbursement for, let's say, a phone call. So it had to be a video conferencing session. But I think they also relaxed the enforcement of that so that you could even have a phone call with your healthcare provider. And and therapy sessions, psychiatry sessions, whatever it is, and they'll allow for reimbursement. So that's huge. And again, we'll see about the security of such platforms. We'll see what happens, but it's been necessary in this time. Those are some of the big things. I mean, for digital health in particular, I think it's been fascinating to we've seen a lot of resistance to the acceptance of digital health for multiple reasons. As I mentioned earlier, one reason is just licensing and all these restrictions and regulations about what platforms you can use, and they all have their reasons. But it's been interesting to see if all of those, this really interesting experiment of if all of those regulations are knocked down and you really, really needed to go digital and virtual, could you and what would happen? And so we're seeing that experiment play out in real time, and it's very, very fascinating. And I think in a lot of ways it'll be difficult to go back. It's so easy now to just be in your home, not have to drive, look for parking at your healthcare provider's office, and it all just kind of happens in your home, which is nice. Of course, you do lose that in-person connection, so it's kind of to be determined what the outcomes will be, but it's been pretty fascinating. And the adoption of digital health, which there was so much resistance to before and all of these barriers, it almost seems like overnight they were just knocked down. And people who, use the excuse, I'm not technologically savvy, or, oh, I'd rather just see a patient in person, or whatever it is, that's all just been knocked down because we just have to do it this way now. And it's interesting how suddenly things that were such a huge issue and barriers before are just not anymore. And I think it will end up changing a lot of behavior around healthcare. I think in good ways, but again, I think some of the security issues that have always been a concern, the privacy issues as well, they're still there. So we'll see what happens with that.
Thank you, Dr. Sobhani, for your time. And again, thank you, Psych U community, for your continued support. Have a great day.
Thank you, too.